Hello, you are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 30-year-old woman at 10 weeks of gestation presents with severe nausea, vomiting, yes, weight loss, and this individual's electrolyte level is severely low. Now, she also complains that she's unable to feed very well, yes, during the day, and she vomits severally, yes, within the day. Now, this is an individual's case, and we need to, answer the following questions. Now, the first question is that what is the most likely diagnosis as far as this pregnant woman is concerned? My friends, your answer is hyperemesis gravidarum. Yes, the reason is that, yes, there's a severe nauseation, yes, coupled with several vomiting episodes within the day. And of course, she is carrying, a conceptus. Yes, there's developing embryo in there, okay, by way of, what is going on inside her womb. She's pregnant, and so the diagnosis is hyperemesis gravidarum. Now, one thing I need you to understand is that although, yes, by way of the exact cause, yes, it's not, yes, well known, but one thing we need to understand is that it's mainly due to, of course, some kind of dynamics, okay, as far as the hormones in her body is concerned. Yes, predominantly, we talk about changes or increased levels of what we call HCG, human chorionic gonadotropin, which, of course, is secreted by the trophoblast, okay, of what we call the developing placenta. Okay, that's one thing you need to understand. And then also one thing is that even estrogen levels, okay, may contribute to, of course, this hyperemesis gravidarum. Now, one thing that is common as far as signs of this or symptoms of this hyperemesis gravidarum. Yes, already we've talked about nauseation, okay, feeling the urge to vomit. Yes, the vomiting itself will come several episodes within the day. Okay, you may not be able to eat so well. Okay, and oftentimes there could be trigger foods, okay, which results in this kind of vomiting. Now, the other thing is that because this individual is vomiting so much, that is why in this case study we realize that, of course, this individual became dehydrated. Okay, so that's also one of the things that may be associated with this. And then, of course, there will be electrolyte imbalance. Okay, several electrolytes, okay, will be lost through, of course, this vomiting, episodes we're talking about. Okay, and no doubt that this individual will emaciate. Of course, there will be that kind of significant weight loss as far as this patient is concerned. Now, the next thing we want to ask you will be that what are the risk factors as far as this hyperemesis gravidarum is concerned? The risk factors largely will be the fact that, yes, what we call multiple pregnancy, by way of keeping, let's say you are pregnant with triplets, with what do you call it, quadruplets and what have you, twins and what have you. Those things become risk factors, okay, for you to develop these ones. And then past history of having experienced it, okay, if you are a multiparous individual, you've experienced it before, then it's likely you may also experience it in subsequent pregnancies that one will carry. Well, even family history may contribute to it. Okay, those things have been shown to have some kind of significant influence over there. And then even individuals, okay, who ladies who experience migraine significantly oftentimes may experience this hyperemesis gravidarum. So my friends, simply put, this hyperemesis gravidarum is of emergency. Yes, because the individual may not be able to eat, he's losing a lot of fluids and all that, vomiting here and there. Then it's important then, of course, one of the things that may be done if it's extremely severe is hospitalization. So of course there will be more fluid, okay, replacement, okay, meted out to this patient. And then of course, what will happen is that some medications will have to be given to minimize, the emesis, the vomiting, okay, so that of course this patient, okay, can recover, very fast. So my friends, one of the things that pregnant women, some of them may experience is of course this hyperemesis gravidarum, severe vomiting, severe nauseation feeling and all that. And so it's important that we understand these things. Of course, the appropriate care is given to them. My friends, this is what I have for you today. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.